Bismillah ar-Rahman ar-Rahim. To begin with, thank you for having me once again. I hope my presentation proves to be highly beneficial, inshallah. Our title today is Could Occupational Health be considered an integral yet often overlooked aspect of public health? As we know, fundamentally, occupational health is often overlooked and underestimated, with a significant gap in the detection and in diagnosis of occupational health issues. So here I would like to ask first, is this considered a public health concern? Second, should it be integrated into primary healthcare services or not? Anyhow, I hope by the end of this presentation, you will not say you left us on read. For this reason, today we will explore how occupational health exemplifies public health in action. Third, here we have a male patient, 52 years old smoker. He's complaining of repeated attacks of breathlessness, cough with expectoration of mucus pellets. Um, he has a past history which was clear except for the last 2 years when these symptoms had started. Family history revealed no similar cases. I expect that all of you are expecting now we have a case of bronchial asthma. On examination, the chest was wheezy, so it's a case of bronchial asthma. Uh, this patient, I have been treating him for 2 weeks with bronchodilators, mucolytics, and expectorants with no response. Okay, no response. I have to start later. Regimen of inhaled steroids had been started, similar to each attack in the past 2 years. Take care of a similar attack in the past 2 years. It will reveal something which might be important. Next week, the condition deteriorated and had been admitted to hospital with a status asthmaticus condition. He responded well to rest, treatment, and been discharged after 3 days with a very good chest condition. Wow. I'm really proud of myself. I'm handling such a case. Feels quite straightforward. I feel accomplished. It comes quite natural and normal with me. So I'm so proud of myself. But stop. 2 weeks later, the patient returned again, reporting the same symptoms and providing a similar account of his condition. What a predicament. I feel embarrassed. The recurring nature of the issue suggests the need of further investigation. Something is missing. Or it might be a reassessment of the initial treatment plan, might be. Anyhow, the doctor, by the end, finds himself in a pickle as if under the weather. So, we have to here is my advice. We have to take our time before celebrating our success. This is the first advice. Second, don't ever jump to conclusions about your achievements. It seems like don't count your chickens before they hatch. I hope you understand me. Anyhow, you hear that there is a pivotal overlooked and disregarded issue. What is it? There is an agreement that there was neither proper diagnosis nor convenient management with an appalling negligence. So, to put it simply here, a critical and deeply concerning issue has been ignored, as I told you, marked by an appalling level of negligence. In a conclusion, um, it's recognized that there was a complete failure in both providing an accurate diagnosis and even in implementing appropriate management. Ultimately, this is highlights a profound oversight that demands immediate attention and accountability. Uh, as it seems here, occupational exposure, all in all, again, occupational exposure, all in all, occupational history should never be overlooked, as it often plays, as you know, a decisive role in diagnosing work-related illnesses and conditions. Understanding patients' workplace exposures, tasks, and environment provides critical insights that can guide accurate diagnosis, effective treatment, and targeted prevention strategies. And ignoring these aspects risks missing key causal factors leading to misdiagnosis or delayed care. Uh, the pitfalls of not integrating occupational health services in PHC services. What could happen if we don't integrate occupational health services in the body of PHC services? First, many occupational diseases and injuries may go unrecognized or misdiagnosed. Okay, or what's on? It will lead to delayed treatment and worsening conditions. It's quite easy. Second, also the poor working conditions contributing to the overall disease burden, which can strain healthcare systems and public health resources. So increase disease burden. At the same time, without occupational health integration, there is less focus on preventive measures, actually, resulting in higher rates of work-related illnesses and injuries. So it means limited prevention. PHC services, as all of us know, without occupational health, will miss an opportunity to address the broader determinants of health. What are the risk factors of occupational diseases? For example, such as workplace environment leading to incomplete healthcare delivery. So gaps in holistic care. There will be a gap in between occupational health services and primary healthcare services, will lead to missing a lot of occupational cases, will lead to missing a lot of occupational risks, and so on. And also in missing in preventive services. Fifth, inequity in health services. Workers, particularly those in hazardous jobs or informal sectors, may lack access to tailored health services, exacerbating health disparities. There will be a health disparity in between the workforce sector and general population. 6 point, lack of integration can also result in insufficient data or work-related health trends, hindering the public health planning and interventions. This will lead to missed public health data. Seventh, economic impact. We know that undiagnosed or untreated occupational health problems may reduce productivity, increase the absenteeism among workers, and will increase or escalate the healthcare costs. So those are the pitfalls of not integrating the occupational health services and PH services. Let's make an anyhow, coming to that point, now let us explore whether there's any alignment in between public health and occupational health. So first, we have to know what is the definition of health and what is the definition of occupational health. The definition of health, as you know, a state of complete physical, mental, and social well-being, and not merely the absence of disease and or infirmity. However, this definition has been criticized always as too idealistic and hard to measure with the word complete, setting an unrealistic standard. Anyhow, it overlooks the evolving nature of health, especially in chronic diseases where managing health is often the main goal. Anyhow, this is what we have. Coming to occupational health, what is the definition of occupational health? Is a promotion and maintenance of the highest degree, again, highest degree of physical, mental, and social well-being, same like public health and social well-being of workers in all occupations by preventing departures from health, controlling risks, and adaptation of work to workers and workers to their jobs. Indeed, and without any doubt, we can detect that definition of occupational health aligns strongly with the concept of public health by focusing on promoting and maintaining well-being, not just preventing illness. So, as we see, both fields emphasize the importance of physical, mental, and social well-being. So, both of them, public health and occupational health, are in same boat or on same road. Moreover, occupational health shares public health's preventive approach, for example, by addressing risks, by adapting to workers and ensuring healthy environment for all, thereby enhancing the overall health outcomes. Okay, one of you may say, that's none of my business. Is it true? Is it true that it's not of your business? We will see. What do you want? What I want? I want a lot. Again, concentrate and focus with me here. Public health is the science of protecting and improving health of people and their communities, which is achieved by promoting healthy lifestyles, reaching or researching disease, injury prevention, and detecting, preventing, and responding to infectious disease. This is definition. Overall, public health is concerned with protecting the health of entire population. So public health is dedicated to protecting and improving the health of the entire population by promoting healthy lifestyles, preventing diseases and injury, and responding to health threats, including infectious disease and so on. All of us know that. While occupational health, again, I will read, its breadth is broad, covering a broad range of disciplines from toxicology and epidemiology to economics and prevention of injuries. So, occupational health and safety is a branch of public health. Again, occupational health and safety, I'm enthusiastic, sorry. Occupational health and safety is a branch of public health that studies illness and accident patterns in the working population. Again, it studies illnesses and accidental patterns in the working population and develops policies to prevent them, just like public health. It spans a wide range of fields, including toxicology, epidemiology, ergonomics, and whatsoever. That area of public health that focuses on illness and accidents patterns in the working population or the workforce sector and develops policies to prevent them is occupational health and safety. So we can easily detect that both public health and occupational health both align in the same way, in the same direction, same scope of action. Moreover, public health is concentrated or focusing on entire population, while occupational health is focusing on a sector of public health, which is workforce population. Uh, Again, I'm trying to prove that both of them, the entire population or citizen and workforce populations, are the same. Yes, citizens and workers are the same people. I will read it. If they work in bad conditions, the citizens or the workers who are part of entire populations are citizens. They are citizens by working in some certain conditions with high risk factors. So if they work in a bad condition that affects their health, it will show in public health statistics. So increased disease rates. You got this point? If such workers work in bad conditions with high risk factors and they are going to develop some diseases, this will be reflected and show up in public health statistics with higher increased rates. I hope you understand these points. So citizens and workers are the same individuals. If they are exposed to harmful working conditions, I'm repeating to understand, if they are exposed to harmful working conditions, it will be evident in the public health data through rising in disease rates. It will be evident in public health data through rise in disease rates. Again, I'm repeating. Uh, so work exposure to occupational risks and working conditions are essential factors for understanding population health. Wow, what important is that statement or that paragraph? I'm going to read it once again. Work exposure to occupational risks and working conditions are essential factors for understanding occupational health force? No, for understanding population health. Therefore, exposure, again, exposure to occupational risks and working conditions certainly play a vital role, very important, not vital role only, it's a very important vital role in shaping the overall health of the entire population, not one part of the, no, I mean here the entire population. These factors directly influence workers' physical and mental well-being, which in turn can affect public health, as I have said before, will affect the public health outcomes and contribute to the patterns of disease and injury with the broader community. In the late 19th century, workers' health, here I mean starting with the Industrial Revolution. So in the late 19th century, workers' health was among the central concerns of the social reform movement to improve public health. So public health agencies should have critical complementary roles to play in conducting, first, surveillance of work-related diseases and injury. Yes, conducting surveillance of work-related diseases and injury is a very important in that concern. Second, investigating health problems related to different occupational exposure, contributing or sharing in implementing prevention activities to protect workers' health. At least as a rudimentary objective in this field is to focus with me to cover the underserved sectors in the community. For what? At least to achieve the equity. Take care of at least here and take care of equity. At least as a rudimentary objective in this field is to cover the underserved sectors in the community to achieve the equity. So the objective in this field should be to address the needs of underserved sectors. Who are the the underserved sectors? I mean the workforce. So to promote equity, at least between all population, because all of them must be served by public health, including occupational health services. If we remember, the COVID-19 pandemic is clearly showing the importance for the surveillance and protection of human health, of acting in all settings of life, family, community, and education, teachers, leisure of work, among others, as well as addressing the multiple determinants that influence the health and well-being of the population, whether demographic, healthcare, environmental, social, socio-economic. Okay, coming to that point, I'm sure that some of you, after that journey or after that short journey, will say, according to our vast accumulated data, you are wrong. So put up or shut up. Okay, we will go on and see. Okay, see here among the, we see the 10 essential health services, all of us know. Assess and monitor, investigate and diagnose and address health problems and communicate effectively to inform and reduce people about health factors, strengths and support and mobilize communities, create, champion, and implement policies. I couldn't read plans and laws. Anyhow, utilize legal and regulatory actions designed to improve and here's the seventh point is very important. Among the 10 essential public health services outlined by the WHO, as we see here, the focus on equitable access to individual health services and care clearly extends to workers. Let's read it. Assure an effective system that enables equitable access to the individual services and care needed to be healthy. So, as a vital part of the population, workers are entitled to the same rights and considerations that the WHO prioritizes for all. Are you convinced or not? Again, assure an effective system that enables equitable access to individual services and care needed to be healthy, and the workers are entitled to the same rights as whole population. Let's go back, or let's go forward to the eighth point. Build and support a diverse and skilled health workforce, assure competent workforce. So, with regard to ensuring competent workforce, again, the WHO emphasizes the importance of building and supporting diverse and healthy workforce. So, occupational health by all its dimensions are within the essential health services. Either we agree or refuse. After that comes the ninth sentence: improve and innovate public health functions through so and so and so. And tenth one: build and maintain strong organism. I don't care. Again, this slide focuses on occupational health services, and occupational workforce is within the focus of interest of the 10 or the focus of essential health services of WHO advices. So we came now to the question: why do we care, or why should we care about occupational health, or why should we worry about the integration of occupational health services within the body of public health services? Or in another form, what is the importance of occupational health, and what is the importance of occupational workforce? Uh, Population overgrowth with increase in working age population and decrease in workforce population. We can find that in 2022 there were about 3.32 billion employed people globally, up from 2.28 billion in 1991, with an increase of 1.04 billion. On the other hand, or on the other side, global employment fell down from 3.3 billion to 3.19 billion between 2019 and 2020 because of COVID-19. Second, a considerable percentage of vulnerable groups in global workforce, like aging workforce, women at work, child labor, informal and unseen labor forces, and this group includes many, like domestic, like household and home-based works, bonded labor, and human trafficking, alongside with migrant workers. All of those groups are vulnerable and are at high risk of occupational exposure. Another point, we spend almost one third of our life at work. Another point, occupational exposures remain a major health burden globally, emphasizing the need for continuous prevention and control effects. Around 20 to 50% of workers may be subject to a real hazardous exposures at work, industrialized countries like USA and Europe. And the rate may be even higher and higher in the developing and newly industrialized countries. Why? Because occupational exposures continue really to cause an important health burden worldwide, justifying the need of ongoing prevention and control initiatives. Another point is their labor forms the economic and material foundation of society, which heavily relies on their ability to work. So the work sustains the economic material basis of society, which is critically dependent on their working capacity. I'll keep silence for 15 seconds, but counting. 11, 10, 9, 8, 7, 6, 5, four, three, two, one, zero. What happened during such 15 seconds? According to ILO, every 15 seconds, 160 workers in the world, anywhere, have an occupational accident. Actually, this fact underscores the scale of the issue. While the annual death toll of over 2 million workers emphasizes the critical importance of improving workplace safety and health standards worldwide. Actually, these figures call for more effective prevention, for better regulatory frameworks, and highlighted the awareness or how should be aware to protect workers and to reduce these tragic outcomes. I've got the feeling that you are or that you started to be angry. Please don't be ashamed of shouting at my face. What's your problem? What's my problem? My problem is the separation between occupational health services and general healthcare system. Actually, it makes me angry because it's marked by significant structural gaps with limited integration of communication between the two. This often actually will lead to fragmentation of care, where patients may receive treatment for their health conditions without considering potential work related causes or environmental factors. This is a disaster. As a result, health problems linked to the workplace, such as, for example, those caused by whatever, for example, unsafe working conditions, by exposure to hazardous materials, or repetitive strain, those people are frequently overlooked. So the lack of coordinated care further exacerbates the challenge of identifying and addressing the root causes of these health issues, like what happened with our patient in the first slide, the one with bronchial asthma, where his history, where his occupational history was ignored. This leading to missed opportunities for prevention and early intervention, for early diagnosis, for early treatment. So this fragmentation in between PHCs and OHC, occupational health services, fail to detect and address health problems related to work and work environment. You know, if we're gonna ask about what is the consequence or what are the consequences of insufficient primary prevention of work-related health problems, we're gonna find a lot. We're gonna find many. First, chronicity of the unrecognized diseases, the persistence of unrecognized disease. More complication with increased complications, unnecessary treatment, rising rates of sickness absenteeism with inability to reintegrate sick and injured workers back to the workplace, affects the productivity. It means here negative impact on productivity. Second drawback is increase in cost. Unnecessary treatment, increase of cost because of unnecessary treatment, because of unnecessary exhaust of health facility resources. I have received the patient many times, many times, and I have referred them to the hospital. He consumed a lot of time, he consumed a lot of medicine, he consumed a lot of care without improvement. Why? Because I didn't take care of his occupational history. This is an increase in cost. Increase in cost in absenteeism with low productivity because of ignorance with taking occupational history. Increase in cost because of rehabilitation, because of unnecessary collapse of workforce, because of legal compensation. This is very important. I'm going to talk about it in another presentation. Third, many public health programs cannot reach working population like tobacco control, addiction control, diabetes control, cancer prevention programs, weight management and healthy nutrition programs, and stress emotional health management programs. These are just only examples, not all. How could the basic occupational medical services be linked with the mainstream of public health? It's very important here. How can basic occupational health services be flawlessly integrated into the mainstream public health framework, ensuring that worker health is monitored, ensuring that worker health risks are mitigated, ensuring that there is a cohesive approach to addressing both occupational and general public health issues in one line. Additionally, what strategies can be employed to enhance collaboration between occupational health professionals and public health authorities? For what? To create more comprehensive healthy system or health system. In this slide, we're going to find the Declaration of Alma-Ata 1978 defines the primary health care as comprising at least 8 key components. They are education concerning prevailing health problems and the methods of prevention and controlling them. Second, promotion of food supply and proper nutrition, an adequate supply of safe water and basic sanitation, maternal and child health, including family planning, immunization against the major infectious diseases. By the way, I'm reading prevention and control of locally endemic diseases. And notice here, I have made a space in between the first 6 components and the other 7th and 8th components. The 7th speak about the appropriate treatment of common diseases and injuries. 8th, provision of essential drugs. So we're going to find that the first, or it's clear that the first 6 components focus on prevention and health promotion, while the 7th and 8th components are more oriented towards curative care and giving drugs. This highlights to what? Highlights to the emphasis on preventive measures and health promotion rather than solely on treatment. All elements are designed to be population-focused, community-based, and person-centered. So we're going to find that the 8 components of Alma-Ata Declaration are focusing on prevention, control, and promotion rather than to be focusing on curative. This aligns with the functions of public health in addition to the functions of occupational health. The Alma-Ata Declaration on PHC 1978 underscored the vital importance of ensuring that health care services are easily accessible to all individuals. And here I'm stressing on the word all. It should be easily accessible to all individuals. No ignorance, no missing one. Emphasizing the necessity of bringing these services as close as possible to where people live, to where people work. Actually, this approach, as we know, aims to remove barriers to access, such, for example, distance and cost, ensuring that every community member, regardless of their socioeconomic status or location, can receive the care and support they need, like each other or like everybody. So by integrating health services into local communities, the declaration, what I want to say, by integrating health services into local communities, the declaration highlighted the importance of making healthcare both available and affordable for everyone, promoting overall well-being and preventing health disparities. So, as a main important or a keystone concern of PHC as declared by Alma-Ata Declaration is that it should be made universally accessible to all individuals and families in the community, where they live and where they work. Here, as a groundbreaking figure about PHC, we're going to find 3. First, it's a whole of society approach to health with universal coverage. This mainly aims at ensuring that the highest possible level of health and well-being will be received by everyone and should be equitable distribution by focusing on people's need to achieve health for all. So it's responsible in some way or another for universal coverage reforms by reducing, for example, the exclusion, by reducing social disparities in health. Second main point is as early as possible. So I'm speaking here about universal coverage with the whole of society approach as early as possible along the continuum from health promotion, disease prevention, as well as treatment, rehabilitation and palliative care along each other or together. So it's responsible also for service delivery reforms by improving the availability and accessibility for all. So now we have 2 points. It's a whole society approach with universal coverage as early as possible. Third, as close as possible to people's needs. Where or when, every day and everywhere, at home and at work, according to this is according to WHO and UNICEF. So it's also responsible for increasing the stakeholder participation to cover as ever much as could be. According to an old estimate of WHO, stated that of the global population, about 70% have access to some form of primary health care. However, I believe that this figure can vary depending on the definition of what is access and vary according to the region being considered. Yes, differs from developing to developed countries. So the figures might be a reasonable general estimate, but it may not reflect the full reality of quality and the reality of equity and PPC centers. Uh, we can find that countries with adequate or at least accepted occupational health services typically must have a strong framework for protecting workers' health and safety, for integrating occupational health services into national healthcare systems, and ensuring workplace safety regulations are enforced. These systems are or should be accepted or accepted occupational health services. Uh, Such countries like, for example, Germany, Sweden, Netherlands, Canada, Australia, the UK, Finland, Japan, Norway, many other European, and even USA is not considered one of the countries who have strong frameworks for occupational health services. Okay, what about Egypt? In Egypt, occupational health services are evolving but facing challenges in coverage and accessibility. While larger companies provide some services, smaller business and informal sections often lack and still lack adequate healthcare for their workers. The government has made efforts to improve workplace safety, but many workers still lack sufficient access to occupational health as expected. Lack sufficient access to occupational health services, particularly in the private and informal sectors. So here we're going to find that globally, occupational health care is only 10 to 15% of workers who have such access, and often this doesn't include those most in need. So that figure in that figures before is 70%. It doesn't reflect the real picture. Okay, uh, now we are about to finish our issue. Uh, we are going to ask ourselves what are the principles of integrating occupational health services with PHC services. First of those important points is sensitizing, and take care of using the word sensitizing the professionals on the vital relation that exists or that might exist between work of the patient and their health by grasping their attention, by increasing alertness. So, raising awareness among the healthcare professionals about the critical connection between patients' work environment and the health is essential. Yes, this includes helping them to understand how specific occupational factors, such as, for example, physical, chemical, or whatever conditions, stress, or exposure to hazardous substances, can impact overall well being. Also, by highlighting this relationship, healthcare providers can better identify work related health issues, also to improve patient care and to foster greater vigilance in recognizing early signs of occupational illness or illness. This approach also encourages the professional to consider the broader context of patients' lifestyle, leading them to more comprehensive and effective treatment strategies. So, I'm always advising my students and even my colleagues, take care of every patient in front of you as probably an occupational case until proved otherwise. Second, we're still in the first, sensitizing the professional on the vital relation. Second, uh, to inform the PHC that health of workers is a part of general health and life. Training in health and work should be part of all healthcare professionals' training to inform primary healthcare about a wide range of concrete risks at workplaces where most informal workers have their jobs, to recognize early work-related illness or work-related ill health, to advise about improving working condition and health at work, to support return to work and preserve and restore working capacity. I'm reading. It's important also in moving towards universal occupational healthcare coverage, targeting first individuals at greater risk or need. Here we have reached to a very important point. Again, under the umbrella of sensitizing the professional on the vital relations that exist or that might be existing in between work of the patient and their health. The role of physician here is take care, proper identification of the causative nature of such disease. That's what we have missed in the first slides when we missed the occupational history of that patient. We didn't ask about him about his occupational history, and we missed the diagnosis. We missed the proper diagnosis, and we missed the proper treatment. So we missed to know the causative nature of such occupational disease. So first of all, the role of physician must have an experience in proper identification of the causative nature of such disease. It's important that the primary care practitioner should take an accurate medical history for establishing preventive measures and eliminating and controlling future cases against exposure. By accurately determining the causative nature of such disease, the healthcare professional can can implement targeted interventions. That's what I spoke about before: precision public health and precision occupational medicine. So he can implement targeted intervention, tailored treatment plans, and develop preventive measures to address the root causes. What is the root cause here? Occupational exposure to some hazard, ultimately improving patient outcomes and reducing the incidence of these conditions, decreasing the chronicity of such disease, decreasing the cost, and so on. Uh, this is very important paragraph. The role of physician may be, take care, the role of physician may be the only chance a patient has to have the occupational disease recognized and properly detected and identified. So this highlights the importance of role of primary care practitioner who may play a vital role in preventing the work-related illness by taking accurate medical histories, as I told you before, to identify links between patients' health and occupational exposures. I told you that before. So, accordingly, and after that, this helps in early diagnosis. I mean, here discovering the probable relation between the occupational exposure and the disease will help in early diagnosis, establishing patterns of the disease and recommending preventive measures to reduce risk, ultimately controlling the future cases and so on. What after? The role of physician, we still under the same point of sensitizing professionals. Role of physician here, he must have adequate knowledge, adequate alertness, adequate experience, and he must take care. Uh, when should we expect an occupational cause? It's very important. I have a patient in front of me in my clinic, and when should I expect a probable or highly likely occupational cause? When we find a medical problem that doesn't fit the typical demographic profile, it doesn't align with the picture of such disease in general. So I must expect here that something wrong. It might be occupational exposure. Second, when an existing disease has acquired new characters or new pattern, I'm sure that the patient with the bronchial asthma are usually complaining of so and so and so and so. Then I found another patient with same symptoms of bronchial asthma, but he's usually complaining of such symptoms every day morning when he goes back to his work. Something wrong here. Third one, when the disease resists treatment. Yes. Fourth, when the problem occurs after exposure to well-known occupational origin and fits all the main criteria of such disease. Here the case speaks about itself. When the problem is affecting many persons sharing same circumstances at work, here I should expect an occupational disease. Second, of the principles of integrating occupational health services in PHC is linking the primary healthcare centers and occupational healthcare services under local primary care networks and providing joint training, referral systems, and occupational information to foster collaboration and continuity of care. So this highlights the importance of integrating the PHC centers with the occupational health services within one responsible local networks to improve both directions. This integration can be achieved by joint training for healthcare providers, by establishing referral systems, sharing occupational information, which usually ensures coordinated care between both. So by facilitating seamless collaboration between PHC and occupational health services, the health systems can better, actually, it's highly expected. The health system can better address workers' needs and provide comprehensive care. Nobody will be ignored, nobody will be missed. So this approach encourages the development of localized strategies responsible for both health services to meet the specific health needs of workers, ensuring both prevention and continuity of care. Third, third one of the principles of integrating occupational health services in the body of PHC services is developing national plans for health of workers. National plans is not our responsibility. It's involving professionals of primary health care, occupational health care, public health, and key stakeholders in the society. Occupational health services should guarantee access to care, allowing for full producing working life, empowering workers' responsibility. I'm reading, by the way, any occupational health services partner, NGOs, non-governmental organizations, and decision makers is critical for promotion of the health and safety of workers, and at last financial arrangements for human and technological capacity, including development of work-related illness. I'm tired. The setting of a research agenda, it's an academic word, theoretical. I don't mean academic, theoretical advices. Now we came to a very important point of our presentation. What's the benefit? What is the benefit of integrating occupational health services and PHC body? First, the outcomes of integrating OHS with the PHCs is sufficient primary prevention of work-related health problems. With what? With avoiding chronicity, I'm usually pronounce it wrong, avoiding chronicity of the unrecognized diseases, decreasing the complications. I mean here by sufficient primary prevention, I ensure avoiding chronicity of the unrecognized diseases or misdiagnosed by decreasing the complications, avoiding the unnecessary treatment, lowering rates of sickness absenteeism. Second, decrease in the cost. We have discussed it before in different way. Decreasing the cost of unnecessary treatment, absenteeism with low productivity, cost of rehabilitation by legal complications. Uh, Third, many public health programs can reach work population such as tobacco addiction, diabetes, cancer prevention, weight management and healthy nutrition, stress and emotional health management. The fourth point is improvement of occupational health services. Here we have came to a very critical point. It's something like crossroad. First, the capacity of the PHC is expected to be stretched, okay? Because we are increasing or we are putting more burden on their backs for taking care another population sector. I speak here about the workforce. So, an adequate response by health systems to the specific health needs of a large group of workers who are currently left out, it's a good point. Yes, a lot of people will get benefits of being included in such a healthcare system. But adding occupational health program might be considered as an additional work burden and might not be welcomed. I mean here, sorry, and try to tolerate me. It might be not accepted by the high authority of PHC. With my full respect and my apology for them, and I agree that adding an occupational health program might be considered as an additional work burden and might not be welcome. Yes, I confess that introducing an occupational health program could be seen an extra responsibility by employers or healthcare providers, potentially adding complexity or increasing workload. Yes, I agree. Some, and sorry for saying that, please try to tolerate me again. Some of you may resist implementing such increasing or such programs due to concerns over time, concerns about resources or costs, making it harder to gain full support of such initiatives. And again and again and again, I'm saying sorry for you, but this is a reality. We have here to measure it as cost benefit. What's the benefit of adding occupational health services in PHC, and what is the cost of adding occupational health services to PHC? And by the end, I think it's a matter of ethical consideration should be taken into account. Again, I know that you are confused now from my speech, and you have to say, you have got to make a decision, please. Yes, please. Don't be ashamed. Don't feel ashamed. Don't be embarrassed. Shout at my face. You have got to make a decision. Yes, I have to make a decision. Yes. Uh, how to take the decision? How to take the decision? The decision should be based on best practices. What are the best practices? It refers here to the most effective and efficient methods that have been proven to yield the best outcomes in similar contexts. We have to see other people, to other countries, what are they or what they are practicing in such a problem. By following established best practices, the decision makers actually can ensure that the approach being adopted is sufficiently sound and has high likelihood of success or might be failure. Uh, Second, by benchmarking. Benchmarking involves making a comparison. So comparing current practices or performance against the standards or top performance in the field. I see that this usually help identify gaps and areas of improvement, also guiding the decision-making process to adopt the most successful strategies from others. So we have to ask ourselves, what is our performance level? What we have now? How do we do now? Second, what are others' performance level? Are they good? Are they doing good or not too much good? Or not to such extent we are dreaming of. How did they get there to imitate them? What would be the creative adaptation? How can we break through? Uh, the majority of countries have drawn up policies, strategies, and programs for occupational health services by, for example, by implementation to fill in the gaps, the infrastructures, institutionals, and human resources for the implementation of strategies, however, remain insufficient. Second, capacity, increasing coverage. I believe it's better to read it by yourself. Uh, Now, I'm sure that you say, now please, God, just let this end. Yes, it will end. It will end now by just one answer. The answer will come now in the form of question. How impressionably pivotal is to integrate the occupational medicine services in the mainstream of public health? This is the end of our presentation today, and I'm expecting to receive answers about that question to know how important is integrating occupational health services in primary healthcare services. Do you agree or do you disagree? Please waiting your answers. Uh, Wishing you all the best. Thank you.